So hello, I'm Ruth from the RSA, and it's quite interesting to do a presentation like this. There'll definitely be less photos of me appearing to be waving my arms around on Twitter, which I'm quite pleased about. So I'm at the RSA, and my work is specifically looking at self-managing teams within the health and social care setting. And having had a big conversation about use of language, I think it's probably worth me saying that when I'm talking about self-managing teams, that really fits across a spectrum of what that means. You know, some people call them self-organizing teams, some people call them self-optimizing teams, and it's very much about principles that underpin the philosophy of working rather than the management structure necessarily. And I would also just add a caveat that I'm not an expert. What I do is joyfully surround myself with people who know a lot more about this than I. And what I'm really here to do is look at what difference self-managing teams can make within a health and social care setting, and what needs to be in place to enable them to really thrive within that setting. This is something that we often talk about at the RSA, the Three Horizons model, with where we are now, what needs to happen to enable innovation and scale for the future. And it's quite interesting, really. I thought about this model last week, and where we talk about this in normal settings, and then we're now in this incredible transition phase of the pandemic, and what we could learn from this and what is coming out of this, and what we need to do to enable those things to actually thrive in the future. So the health and social care setting, we started to look at why it needed to change, and we identified a number of key points. There's often a lack of understanding by the general public, especially in relation to social care, but equally within health in terms of how services are designed and delivered. And as a result, there's often little will in the public to enable and support change within those settings. The systems, especially health and social care, are phenomenally bureaucratic and hierarchical, and as a result struggle to respond effectively to complex needs. And the physical and emotional pressure that are on staff to perform in what has become a real time and task model of service delivery in health and social care, which really limits the way that they can interact with people on a human level, because we are essentially boiling people down to periods of time and specific tasks that they need, rather than what do they need as a human being to thrive and survive. And commissioning models have progressively moved towards, sometimes as a result of the severe cuts to funding, towards delivering short-term outputs rather than looking at that long-term well-being that should really be embedded in health and social care. So looking at social care in particular and the policy context, over years social care is very much a piecemeal service. It didn't have that big clear focus of creation that the NHS did, and as a result, since its inception and over successive governments, it's never really got a grip of what it needs to happen at a systemic level, that is able to cope with the population changes that have happened over the past few years. Austerity has particularly affected social care, and the system is really limited in its design to meet the needs not just of the current population but of a future population. Care workers, and you know, there's a lot of talk about this now with the pandemic, but they're one of the most overworked and underpaid and at-risk groups in society. They actually have one of the highest rates of suicide of any demographic group. And there's been a huge amount of focus on addressing the funding gap for social care, but it is equally as important to look at system design, because if we increase funding, that doesn't necessarily mean that the service is going to still meet the needs of the population. So self-management in social care, there has been, and I think this is quite significant, there have been developments that are continuing and thriving within social care that are self-managing, based on self-managing principles, that where we have had these happen in health settings, they have struggled more. It is still early days, but there are a number of organisations, in particular wellbeing teams, that were set up as an organisation based on self-management principles. And then Cornerstone, who are a large third sector social care provider in Scotland, who are on a journey transitioning from a hierarchical organisation into one based on self-management. And then there are places that are looking at commissioning differently, that enables the system more widely to move towards being self-management. And in particular, those are places like Monmouthshire, Torbay and Gwynedd. So what difference could self-management make in health and social care? And I think a big one for social care is the improvement of staff retention. Those organisations that I've mentioned have much better staff retention than the sector average, which obviously has knock-on effects because you're reducing things like recruitment costs. Staff will regularly cite that they are happier and more motivated. This is due to things like they're in control of their rota, they have more autonomy, and they're able to use that in a way that helps them build more therapeutic relationships with their clients. Their client base is happier, they're able to spend more time with people, and that time is of a more quality base rather than being time and task. And it enables more flexibility for people, so that you're not just engaging with somebody in a way that is very task focused and becomes much more human centered. There is obviously one of the real benefits, and Buurtzorg in Holland is a big example of this, of cost savings, because you are reducing that backroom staff function, you're reducing the staff churn. And there is evidence to show that care packages are reduced because you're actually giving time to empowering people themselves, rather than actually, as a lot of the time and task models do, disempowering them. Staff are recognised for their skills and the abilities and the importance of their role, and it creates a team environment, which in home care in particular, where people are working often in isolation, is really vital. So what could the world of health and social care look like with self-managing teams in a post-COVID world? There has been increasing interest in self-managing teams and developing these across health and social care prior to the pandemic. And then anecdotally, I've been speaking to healthcare professionals who have said that because of the nature of how they're having to respond and the pace of that response and the need to be working in a less hierarchical way, that many teams are becoming to some degree self-managing. And it's a real opportunity that that staff and workers are being shown more trust. Those who might have been regarded as being more junior are being given more responsibility to develop things and move forward with ideas that they previously may have needed weeks, if not months, to get approval to do. And there's a real opportunity with the profile raising of what social care is and the potential it offers and the value of that, of the work that people do, is to really look at how that service is delivered, and self-managing teams are a real opportunity, I think, there. As I mentioned, this is quite a whistle-stop tour of self-managing teams, but obviously I'm happy to answer any questions. So thank you all very much.